What we can be certain that India is definitely better prepared than it was ever to respond to any epidemic, outbreak, or pandemic. However, if we think what it could have done differently, what could be done differently is that there are still some challenges. One, the disease surveillance system which exists in the country is very variable. Like some of the states which were doing better earlier are still doing better, and some of the states which has a weak disease surveillance system, even in those, the surveillance system has improved, but I'm not very confident that those states are fully prepared. So what we need to remember, there is a variations in the preparedness. Everyone has improved, but improved from that baseline, and there is a lot of scope for improvement. That's one broader area. Second, we have heard a lot of discussion about data, health data, and use of data for response, but it faces the similar challenge because your surveillance system is weak, you are not generating the data, and then these are the same states which are not utilizing the data. So there is a lot of scope on improving use of collecting health data, then analyzing that data and use for action. Key part is that one of the challenge which have widely been recognized, that even if data is available, it is not there in the public domain. What we need to remember that data can be effectively used when all the experts who exist in that universe come and look at it. It's not a one particular agency should be looking at, because that may not, due to variety of reasons, that particular group or particular agency may not be in the position to analyze or interpret in the right way. So that's the second thing. These are some of the challenges which still continue. But I also want to close on this aspect. I also want to discuss this aspect on positive note, that on every aspect, both national level or state level, there are improvements following COVID-19 pandemic in India, and I think that's very heartening. What I think, that there is not enough scientific evidence to say anything conclusively about what would be the future of COVID-19 vaccination. What we need to remember, that 2 shots of COVID-19 vaccines provide sufficient immunity or prime the immune system of individual, and after that, though antibody level decline and a subsequent shot of vaccine results in further increase in antibody level, but we really do not know whether a fourth shot would be useful or not. Considering India's situation where nearly 97% adult population has received at least one shot and 90% plus both shots, and there have been a high transmission of Omicron variant during year 2022. So nearly entire population has at least 3 exposure either to the vaccines or virus, and they are protected. Now, how long this immunity lasts, we don't have evidence. It is certain that with the time immunity will decline, there would be changes or mutations in the virus. So people might require additional shot. Now, what would be the interval between the third shot and subsequent shot? It could be 1 year, it could be 2 years. It also depends upon emergence of new variants. So we have to wait for the more information. In that backdrop, I personally don't foresee immediate need for another shot, but that's something we should keep watching for the data and keep track of the various COVID variant, and that will help in arriving a right decision. One thing is given, that in every part of India, there is a need for strengthening primary healthcare system. We need health services which are accessible, available, affordable, and if it's being delivered by government, free for the citizen at the point of use. And in that sense, India has one of the weakest system is the primary healthcare system. So any system which is designed to provide primary healthcare closer to the people, especially marginalized people, is the right step and most welcome. In that sense, Mohalla Clinic do exactly that. They provide free medical care by qualified provider along with the diagnostic services and medicines. So Mohalla clinics are the right step in moving in the direction of strengthening primary health care. Some other Indian states have adopted such mohalla clinic in their setting with different names, such as Basti Dawakhana in Telangana state, and other Indian states have also adopted at smaller scale. This is an important initiative and biggest success in my opinion of Mohalla Clinic or Basti Dawakhana is that they have brought health to the policy attention or political attention, and that itself is a success in this area. Having said that, I also want to emphasize that one of the weaknesses of these initiative is that they focus far too much on medical care. This a stronger primary health care essentially means medical or curative care plus essential public health services. So all states need to strengthen primary health care. They can start with something like a mohalla clinic or curative services, but even mohalla clinic or Delhi government need to think of adding essential public health services in their system. The worsening of air quality toward the end of year in Delhi, this is happening for last so many years, reflects a deeper malady of India's healthcare system and also public policy system. This reminds us the fact that even though we recognize the problem, and when problem is in front of us, we start or we give a semblance of acting upon it. What it requires, any problem, a lasting solution requires that even when the problem does not exist, we should act upon it. So we every year around starting October or November, we start hearing a lot of debate, discussion at every level, technical expert, policymakers, and politicians who talks about air pollution. And then the problem is usually resolved with its own rather than intervention by the authority. If we want to really solve the challenge of air pollution, of course, there are understanding that what all factors contribute to the air pollution, and those factors need to be addressed. But those need to be addressed well in advance. The preparedness or the actions should be done action should be taken round the year rather than thinking when we have a worsening of air quality in the city. So, to me, the challenge is to me the air pollution related challenge in Delhi every year reflect our lackadaisical approach to the all other challenges, and that's what we should be focusing upon. As far as solutions are concerned, when we know the problems, it is possible to devise the solutions or implement those solutions. The only thing is that willingness of those who are in the power and who have a capacity or capability to implement those solutions. India definitely has made a lot of progress in health sector over last 75 years. However, this progress is not enough to the potential the country has, and to the expectation. This progress does not meet the reasonable expectations of the citizens or technical experts. We have moved from like the life expectancy at the time of independence in India was 32 years. This has now become 69 years. So this is definitely a good progress. So we should acknowledge the progress or success in healthcare in India. However, as a civilized nation, as a responsible nation, we cannot simply keep celebrating our successes and not thinking of the challenges which still are pending. So one of the key things is that while we should celebrate success, we should also look ahead. One of the key challenges in front of India is emergence of non-communicable diseases. There is a high burden of the risk factors for cardiovascular diseases such as diabetes, hypertension. The lifestyle is changing. Even the rural people who had a habit of regular physical activity are moving to the city, and then cities are not designed to facilitate cycling or walking on the feet. And a large proportion of India's population is affected by diabetes, hypertension, and many of them are not aware. The preventive factors which can help in reducing this burden cannot be implemented because of many urbanization related challenges, because footpaths are disappearing, there are no cycling track or path, and people are really busy. So what should be done? one of the best ways is strengthening primary health care, focusing upon preventive, promotive interventions, and these implementing these interventions across the sector. So health sector need to work with the different sectors, raising awareness in the citizen about adopting healthy lifestyle, working with the urban development ministry to develop cities in a way that footpaths are created, cycling tracks are created, facilitating parks. So there is a need for health sector to strengthen primary health care, work with the different sectors, and bring health in all policies, and which essentially means working with literally for each of the health related risk factor. Their experts have identified 10 to 12 different departments which need to work upon. And final point I would say that it is a time that if we want to make an impact on a non-communicable disease risk factor, it is time that India need to focus upon school health services. We need to catch the school age children young, uh, do all the intervention which will help them adopting healthier lifestyle and avoid those risk factors. So treat those who have a disease, but prevent also will have to be approached. Stronger primary healthcare system which works in collaboration with other sector. That's what will make India healthy in 2047.